And from the bedside, how has GWAS influenced the clinical practice? And
I think that's been a bit slower to emerge, to be fair. I mean, I think it's always important to remember that we're only a decade into this science, and really only for the last 4 or 5 years really doing studies in a well-powered way. I think we've learned that for many complex diseases, it's not been as easy as we might have imagined to use the information for individual prediction. But we have, for example, started to be able to identify novel therapeutic targets for which we have human validation. We've been able to use this information to identify prospective biomarkers that we can use to stratify risk of disease and type of disease. And we've been able to use in some cases to understand why some treatments work better than others for a particular individual. So I think we are starting to see this information permeate through into new opportunities for translational research, but it's going to take some time, I think, until we really have firm inclusion of this information in all aspects of clinical medicine.
so, in your view, where is the field moving?
Certainly from the point of view of discovery, we're moving away from genotype-based arrays to whole genome and whole exome sequencing, so that we not only look at the common variants, we look at the rare variants. But I think increasingly we're tying this genetic information to the biology of the tissues that we think are important to give us mechanistic insights into disease, and increasingly tying it to large biobanks and electronic health resources, which give us access to clinical data, so that we can understand how individual differences in genetic predisposition map onto subtypes of disease, progression of disease, response to therapy, and so on, in ways that we haven't been able to hitherto.